This is Dr. Andrew Jones. In this edition of Veterinary Secrets, I'm going to be discussing medications that are toxic for your cat. Hello you guys, welcome back to my channel. For those of you who are new, welcome. In today's video, I'm featuring one of my neighbor's cats. His name is Jasper. He's going to make his guest appearance. I have tried to take his picture, do a little bit of filming him in the past, and he's not so crazy about restraint. And I think he's figured out when I have this little getup on and he can smell potentially vet clinic stuff, it's a bad thing. He's pretty smart. So I'm gonna bring him into the video, see how he does. But the big point of today's video is we're actually gonna be discussing 5 common medications, or these are human over-the-counter medications that most of you are gonna have in your house that can be very toxic to your cat. So what are the medications that are toxic to your cat? To begin with, the most common one of all the different human medications that most of us are going to have in our house are the anti-inflammatory drugs. Right now I've got here is ibuprofen. Some of the other ones would be aspirin or ASA. And then there could be also some of the human prescription ones, some of the veterinary ones, such as, for instance, Rimadyl, such as meloxicam or Medicam. One of the anti-inflammatory drugs that is prescribed in veterinary practice a fair amount for cats is meloxicam. One of the brands is Medicam. But they're all under the class of NSAIDs, or non-steroidal anti-inflammatory drugs. The big points that need to be made here about these drugs in particular is, first of all, there's a varying response amongst cats. In terms of, occasionally a cat can have 1 dose and they can be fine, but it can be the follow-up, the second dose or the third dose. So the variations amongst metabolisms amongst cats. Cats generally, they have a different form of metabolism, how they're breaking some of these drugs down within their liver. They lack some of the same enzymes that dogs have, we have, so they can have more difficulty breaking those drugs down. So what that means is that the levels of that drug can build up quite quickly within their blood system, and then damaging some pretty important vital organs, such as damaging their kidneys, leading to kidney failure, causing things like stomach ulcers, vomiting and or diarrhea. And it can happen fairly quickly. In veterinary practice, it wasn't uncommon for us to, trying to think, what can we give a cat? He's in pain, he needs some type of anti-inflammatory. To give a one-time dose of something like meloxicam. But the issue there is, as I just said earlier, some cats metabolize it differently. If I had a cat in serious pain, I had nothing else, no other choice, I need to give him some instant pain relief, I would consider that as a one-time dose, but I definitely wouldn't be giving it at any form of more than 1 or 2 days at the maximum. All the other drugs that I mentioned, such as this one here, the ibuprofen, you need to be avoiding. Never ever giving it to your cat. Things like aspirin, never ever give it to your cat. Any of those anti-inflammatory drugs. Another very common drug that most of us are going to have in our house is acetaminophen. The most common brand it's sold under is called Tylenol, but it comes obviously in the generic form. The actual drug name is acetaminophen. For instance, here I just went through our drug cabinet and I didn't find Tylenol or acetaminophen by itself, but I found this one here, Robaxacet, and yes, it's got one medication called methocarbamol. It's a muscle relaxant, but the other pain relieving medication in it is acetaminophen. So one single tablet, a low 325 milligrams of acetaminophen is toxic to your cats. You can put them into liver failure and secondarily then damage their red blood cells, and it's causing a condition called methemoglobinemia, where they'll actually come in and their gums are looking like a dark blue, almost or a charcoal brown color. So another drug that's very toxic to cats, never ever give it to your cat. The third medication is the topical flea and tick medication. So here's one here. This is Advantage or imidacloprid. This one is specifically for dogs, so it's fairly higher concentration or larger volume. This other one here is the Advantage Multi. This other medication here is Advantage Multi. It contains the drug in Advantage, imidacloprid, and also moxidectin used to treat heartworms. There's a couple points. First of all the different drugs that are used in veterinary practice for our cats, it's the topical flea and tick medications that are reported to have by far and away, the most number of side effects. And there's a couple big reasons. First of all, the issue is people will go pick up dog ones, trying to save some money, give a little bit less to their cats, put it on their cat. They're giving far too much of a concentration. Secondly, our cats are really good at grooming themselves, so they'll put it in areas where the cats then ingest it orally, once again increasing the likelihood of becoming toxic. And then the third big point is that there's just issues around the safety of these topical flea meds, period. In terms of, it's a drug, it's an insecticide that gets either absorbed through your cat's skin into your cat's body, and or just put on topically where it's spread within the fatty layer of your cat's skin, as in the case of Advantage. But our cats are so good at grooming themselves, and as I referred to earlier with toxicities with the anti-inflammatory drugs, our cats metabolize so many of these drugs differently. So my big point about these flea and tick medications is only use them if they need to be. You've got this horrible flea outbreak, you can't control it naturally. And just be very cautious, make sure it's something specifically designed for cats, and just use what you need, putting it in the appropriate place in between the shoulder blades, where a cat has the lowest chance of licking it off. Another common human medication that can be toxic to your cats are the topical anesthetics. And there are things that you would not suspect. For instance, this gel here, which is meant to help for stings or bites. And what it's doing is it'll partly numb the skin. So for instance, it's a gel, it's easy enough to put on. Say your cat, for instance, has got a small laceration. I've seen this in practice. A client thought they want to be helpful, I want to relieve some of his pain. So just squeezing a bit of this gel out, putting this around the wound or on the edge of the wound. Seems like a good idea. It's just topical anesthetic. How toxic can it be? The big point once again is one, our cats are so good at grooming themselves. You can just put a small amount, a small area of their skin. It's actually a substantial amount for the size of your cat. And then they're once again grooming themselves, ingesting all that lidocaine orally, for instance. And that can produce things, not just oral stuff such as drooling, but it'll also produce things such as cardiac or heart arrhythmias. So just to be safe, just don't use any type of topical anesthetic gel on your cat. The last thing I want to discuss is the steroids, but in particular the long-acting injectable steroids. And I've got a picture up here in the corner of the video so you can actually see what it is. The one in veterinary practice that is used a lot is called Depomedrol. And it's a long-acting injecting steroid. It's convenient, you just have to give it, maybe once every 6 to 8 weeks, sometimes every 12 weeks in veterinary practice. There's a whole number of different issues with steroids themselves. But this one in particular, yes, it may be helpful. For instance, we've got a cat that has a food allergy, or perhaps a cat's got a thing called asthma, feline asthma. We're trying to suppress the immune system in some way. Obviously, it's better to naturally treat that as opposed to using conventional drugs such as a steroid. Some cases, there's no other options, or it's just really difficult to treat. And I'm thinking of something such as feline asthma. But the issue though is that steroid itself is having long-term effects. And we can't just withdraw it. You give this one injection, how do you then treat your cat if they're having a side effect? Because it can cause things such as increased drinking, increased urination, but then secondary things, such as diabetes, such as pancreatitis, suppressing your cat's immune system. So my big takeaway there is just be very cautious. I would never give it to my cat, regardless of the condition. And if I were to use a steroid of anything, I would give something orally or something transdermally in their ear, where if they do have a side effect, I could withdraw it right away. Thank you guys for watching this edition of Veterinary Secrets. Thank you, Jasper, for being our cat in the background. I chose not to restrain him because he's just not happy with restraint and my veterinary smell and the camera, you name it. Whatever reason, he's a cat and he's happy looking outside, wanting to be outside. So it's great he's in the video. If you've yet to do so, I encourage you to subscribe. You can do that by clicking that link just above. And then you go ahead, click that link in the box below. I can send you my free books and videos on how to heal your cats at home with my top natural remedies.